everyone. I will just quickly switch to my presentation. If you don't mind, I just switch video and we can move. Just one moment. I will open the presentation and hopefully you can see it now.
Yes, sir.
So, yes. Okay. So I just want to share some thoughts about utilization of AI in medicine, medical science, and just to show you the reality of that. I'm not going to talk only about the excitement, but also about the cautions. What is the current state of that, and where we are in terms of medicine. So, in theory, we could think that AI should revolutionize the medicine. Why? Because medicine is a very specific area, because every doctor has to acquire a lot of knowledge, which requires many years of education and then the experience with the patients. So it is very costly and this is very time consuming. So finding or implementing the AI into the medicine, into the medical field should enable us to improve significantly the efficacy of the healthcare system, no matter in which region of the world, and should reduce significantly the cost and improve the efficacy in terms of the diagnosis and the safety of the patient. Why? Because all the data, all the diagnosis and the treatment is really based on the repeatable data. I mean that in theory, the diagnosis of the disease, this is kind of algorithms and the protocols. And of course, the AI has entered the field of medicine very quickly and very strongly. And is moving forward. I mean, so there are more and more companies, more and more solutions available on the market. And actually, there are 5 main areas where the medicine is AI is utilized in the medicine. So first of all, this is scientific research and discovery. So finding of new drugs, new possibilities for the therapies, or new indications for already known drugs. For instance, we know that there are some drugs which used to be used as antibiotics and seems to be quite effective in cancer, for instance, and other examples. Second area is diagnosis. So the AI should or helps actually diagnosis of the patients in different areas, because so this can be kind of supporting tool for physicians, but also for radiologists, etc. Third area is the treatment recommendations or suggesting what to do with the patient, how to proceed with the medical intervention. The fourth one is the patient medical support, and we very well know about that. So there are different type of wearables where we can almost live monitor patients' parameters like blood pressure, sugar, etc. And the fifth one is the administrative work, so to make this part easier, quicker, and simpler, not only for doctors, but also for all the healthcare system. And what are the opportunities? So the main one is in radiology, for instance, because the MRI or CT scans are very repeatable between patient to patient. Also, it is the same with the histopathology, so all the slides and looking at and diagnosing of any diseases and dermatology. I can give you an example. So Google issued MedGemma model, which was trained on 10,000 clinical cases. And this model includes 50,000 skin images and covers 136 different skin conditions and diseases. And based on that, it can be actually for free downloaded. You have to have the interface to use it, but then this is a great tool to support the dermatologist in the diagnosis of any type of skin diseases. Just for your comparison, that if one single dermatologist seeing 10 patients per day would need to have the same experience of 10,000 clinical cases, it would he would need or she would need 25 years of practice. So looking from this perspective, this is a great tool and something which really supports the diagnosis and the doctors in their daily work. And probably you have heard already that the statements somewhere in the, on the conferences that the radiologists will no more be needed in few years, maximum 10 years. The same with the pathologists, that all will be replaced by AI. And what is the reality? I want to quote one study which has been published in UK based on the UK data, and it was published in December 2025. And this study was based on the real-world evaluation of dedicated LLM for support the primary care in NHS. As far as I know, it was the first study, and the idea was to collect data of 277 patients, look at the history, electronic medical records, and give these cases to this LLM model, medical model, with the request to put the diagnosis and then to propose the intervention, medical intervention. So it was the study, and the control was that experienced clinicians also looked at these patients and put the diagnosis and also propose the intervention, so kind of treatment optimal for that patient. And the outcome of the study was very, very interesting. So in terms of the diagnosis, the correctness of AI was 100%. So it was perfectly in line with the clinician. No actually single mistake in the diagnosis what patients suffered from. But in terms of the treatment, medical intervention, only 47% of compliance was noted. So actually very well and much lower than expected. And why was that? There are different reasons, of course, and this is the very short presentation, so I'm not able to talk about everything. But the main thing is that AI has some problems with the contextual reasoning. And there are different things which is under this. So first of all, this overconfidence in uncertainty limits, and secondly, applying standard guidelines without adjusting for individual patient context. So AI just take data and do not have any kind of other things or other items to consider to interpret this data. Misunderstanding how the healthcare system is delivered in practice. So the theory is one and the practice is totally different. There have been sometimes factual errors, so inventing of some things, and the blindness. Just the best example could be that for really terminal sick patients, they proposed very intense treatment. For instance, the patient with advanced cancer had renal failure, and the AI just suggested that the main reason of the patient was disease was the renal failure. So the main treatment was just to support or to prescribe drugs for renal failure. Other example is that the patients who was really close to pass away was suggested intense treatment, while the real world data is just to make them their life in comfort for the last few weeks or even days. So just why it happens and why the AI has some limitations or significant limitations There are different areas. I only want to cover the main ones. So first of all, this is the bias in automation. I mean, very often AI, we treat as black box oracle uh, without validating it against local data, guidelines, and reality or patient context. Secondly, there's a bias in AI models. So they are very often trained on unrepresentative data sets, different type by race, by gender, status, geography, standard of care, and it cause that then the outcome or the suggested solutions by AI are not right. There is lack of transparency. This is more or less the thing which we try in medicine to fight. So actually, we very often do not understand what kind of data and models were used for training of the models. So if we are not aware about that, we don't know what is the path of the thinking of the AI. There are also problems with data quality, data privacy, and AI is very sensitive to incomplete or noisy or mislabeled data. And as the outcome, there's unrealistic expectation of the from the AI, and is more hype at that moment than reality. So, just to summarize, the AI is really a very great tool for doctors and for medical care. And at this stage, it is only a supporting thing. It makes easier the life of the doctor, but it will really take time to replace doctors from his job, or even if ever it will be possible, also due to the mental things. That's all from my side. Thank you very much. If you have any question, feel free to ask.
Thank you for presenting a balanced and thought provoking perspective on artificial intelligence in healthcare. Your insights in both opportunities and challenges were highly valuable. We sincerely thank you for your excellent presentation. Thank you so much, sir.
Thank you.